to spend the next half hour giving you the most effective evidence-based veterinary information that I'm aware of to prevent scours in beef calves. For cow-calf producers approaching calving season, this is an explanation of the concepts behind the Sandhills calving method. And whether you're from the Sandhills or not, understanding these concepts can reduce animal suffering in addition to saving money and time, and can just make raising cattle more enjoyable. So this may be a review for some of you, but I think it's extremely important to regularly revisit this type of powerful information. So I did not come up with the Sandhills calving methods. My predecessors here at UNL did, in conjunction with several Sandhills ranches and their veterinarians. So these methods have been used successfully over the last 20 years in Nebraska and elsewhere. And I consider their ideas here in the Sandhills calving methodology a major advancement in the care of beef cattle. So I'm looking forward to explaining it to you. All right, so what is calf scours? So scours is a livestock term that just means diarrhea, loose, watery manure. It usually strikes from birth to approximately 1 month of age, and severity can range from a mild loose stool to a fatal case. It disrupts normal digestion and can lead to rapid dehydration in beef calves. So you can see in the diagram here, as dehydration worsens, the calf's physiologic state worsens from fairly normal to depressed to critically ill, unable to rise, and then down past 12 to 14% dehydration, the calf would be dead. So the calf's appetite and attitude are the best ways to judge how severely it's affected and what needs to be done with it. Ask your vet for more information on treating any affected calves on your operation. All right, so what causes scours in calves? A list of pathogens can cause scours. Viruses, bacteria, and protozoa are all represented on the list. These pathogens include rotavirus, coronavirus, a bovine type, E. coli, salmonella, and cryptosporidium. And then there are others as well. These pathogens are usually found as co-infections, meaning that sick calves are infected with more than one at a time. And several of them are zoonotic, meaning they can cause an infection in people as well. So your own biosecurity practices, including wearing gloves, washing hands, and careful handling of contaminated boots and clothing, will help keep you and your family healthy if you must work with sick calves. While I was going through vet school, a student in the class ahead of mine got crypto from a calf and accidentally took it home on his coveralls and spread it to his whole family through the wash. So it was that was a really good learning experience. So it's important to be careful when dealing with sick calves. All these pathogens typically cause illness within the first month of the calf's life. That's another important thing to keep in mind. All right, so what are some of the risk factors? So wet, cool weather, and mud promote the survival and spread of these pathogens in the environment. High stocking densities means a lot of animals in a small space, and this leads to higher pathogen load and more effective contacts, and I'll define those terms here in a minute. So herds with early spring calving seasons tend to have more difficulty with scours than herds with later spring calving seasons. And fall calving herds tend to have a little lower incidence of scours as well. All right, so what is an effective contact? An effective contact occurs when a susceptible calf contacts infectious fluids from a calf that is actively shedding pathogens. So a calf that's already infected, that pathogen is replicating in that calf's body and it's actively shedding pathogens, and then another naive calf comes into contact with those infectious fluids from the infected calf. So that's an effective contact. So one thing we can look to is how does the dairy industry often choose to manage exposure to calf scours pathogens? So some of you probably already know the answer. They use calf hutches. So Breakdowns in calf health on these dairy calf ranches are typically breakdowns in sanitation and can be the result of workers inadvertently carrying pathogens from one calf to the next. But Hutches, just by their very nature, are a method of preventing exposure of naive calves to pathogens being shed by other calves. So most calf scours pathogens are passed via the fecal-oral route. So fecal material is the most likely substance to spread these germs. This could occur when an immunologically naive calf nurses from a contaminated teat on its mother or picks pathogen up off the ground or off of contaminated feedstuffs or the water tank. So lots of possibilities when animals are in close contact. Okay, so what do I mean by pathogen load? And it has to do with serial or sequential infections. So these scours pathogens are usually present at low levels in the cow herd. Cows shed small amounts of these pathogens into the environment and do not show any signs of disease. And then calves with naive immune systems can pick up small amounts of those pathogens, develop a mild infection, and then shed much more of the pathogen into the environment while still not showing signs of disease. So the problem arises when later calves come along and pick up much larger infectious doses of pathogenic microorganisms. And as they develop an infection and shed it, they contaminate the environment with many times the original amount present when just the cows were there. And those later calves can show significant signs of disease. So this sequential buildup of pathogen load is what can lead to the most disastrous scours outbreaks. Those huge pathogen load infectious doses that the later calves receive can overwhelm their own immunity and the immunity that they receive from their mother via the colostrum. So here I have a green arrow showing the spread of a small amount of pathogen from the cow herd and other older calves to a naive calf who amplifies that viral load or bacterial load and passes it to another calf. Now we have a yellow line, and then it gets amplified further, and then that calf can pass a huge infectious load onto the next calf. So that's what I mean by serial infections. Okay, so what does a typical scours outbreak look like? Up to 100% of calves can get sick in some of these scours outbreaks, and death losses can be 15% or even higher. So they can be pretty horrible at times. Treating sick calves dramatically increases labor and expense, and then there's both injury risk and infection risk to people providing treatment. There's also a very real emotional cost in the frustration of seeing calves that were healthy now succumbing to disease and sometimes dying despite treatment. And there are some documented cases with 80% mortality in some groups of beef calves, so it can be catastrophic. Okay, so around 2000, 2001, several Sandhills ranch managers approached UNL researchers with severe annual scours outbreaks occurring on their ranches. As researchers began to gather information, they noticed that calves born at the beginning of the calving season, so like here, these early dates through the calving season, rarely got sick, but as time went by, towards the end of the calving season, calves almost always got sick, and the risk of dying for calves born later in the calving season goes up drastically. So they essentially designed the Sandhills Calving System to allow the calving season to restart as many times as needed to get all calves a relatively clean environment to spend the first month of their lives in. Okay, so how does this work exactly? So multiple calving pastures are needed, and they need to be clean, meaning that cattle have not been in them for weeks, at least weeks up to months. So the entire calving group is moved into the first pasture for 1 or 2 weeks, and then any cows that have not calved are moved to the second pasture. All the cow-calf pairs are left in the first pasture. So they calve there for another week, and then all the heavy cows are again moved to a third pasture. And then calving season continues like this until it's over. calves remain with other 1 week age cohorts, meaning they're with all other calves are within 1 week of their age until the youngest calf is 1 month old. And at that point, they can be grouped up again. So it may sound harder than it is. If you've had a chance to be involved with it, it's amazing how quietly the heavy cows move off to the next pasture and how reliably the cow-calf pairs stay behind. So it's not perfect, of course, but it's usually easier than it sounds. So here's a cartoon version of how this works. This is from Dr. Jeff Ondrak. He made this animation. So you can see for weeks 1 and 2, all the cows are in the first pasture, and one will calve, and then the rest will be moved to the next pasture. And they'll calve there for another week, and then everything that hasn't calved will be moved on to the next pasture. And they'll calve there for a week, and all the heavy cows will be moved off to the next pasture. And it just continues in this fashion all the way through the calving season. So if calving season is 2 months long, then it's 8 paddocks are needed, 8 pastures. Oops, I went back. There we go. Then the calves turn around. That was a nice part of the animation. One more calves. And then we get to the last paddock and we're done. So that is a basic rundown of how the Sandhills calving method works. Okay, so these ranches that approached UNL researchers, the first of these herds made the results public at the Range Beef Cow Symposium in 2003, and that's some of the data that's here on this sheet. Oops, right there. So case herd number 1 was an 800 to 900 cow beef herd. Calving began each year in early March. Cows typically calved in lots, and then the calf and cow were paired out into larger pastures. The mortality rate due to scours was 14%, and then 6.5% in 1995 and 96, and then 8.2% in 99, and then similar in 97 and 98. Expenses for veterinary supplies like fluids and antibiotics for calves were over $3,000 all through those years. And then in 2000, they began using Sandhills calving methods, and they did it just like we went through on the animation. They split animals. They started the entire group in one calving pasture and then moved the heavy cows weekly until they were done with the calving season. And in the 3 years since implementing Sandhills calving, there were no calves that died of scours at all during that time. A few were treated in 2000, and then no others were even treated for scours in 2001 or 2002. The owner estimated that the savings in more calves weaned, improved calf performance, and reduced expenses for treatment were somewhere around between $40,000 and $50,000 per year for those first 3 years of adopting Sandhills calving. So that's a pretty breathtaking achievement. The next herd was similar. Case herd number 2 was a 400 cow beef herd using rotational grazing and early summer calving. So a little different than the first herd. Calving in this herd occurred as cows moved through a series of pastures every 2 to 4 days. This herd experienced 6.5% death loss in 1999, which was 28 calves, and 11.9% in 2000, which was 11.9% of the, which was 48 calves out of 402 births. So that's pretty hard to take, without a doubt. So they adopted the Sandhills Calving System in 2001 and continued in 2002. It differed slightly from case herd 1 in order to meet the requirements for the intensive grazing system. So groups of cattle moved to different pastures throughout the calving season as appropriate for forage utilization, but every 10 days or whenever there were 100 calves born, the herd was divided by sorting off all the heavy cows from the pairs. So in this manner, the number of calves within any pasture group never exceeded 100, and all the calves within a group were within 10 days of age of each other. So achieved basically the same goals, just with a little different method. So they were remixed, they were commingled after the youngest calf was 4 weeks of age. And no calves died of scours in 2001 or 2002. Total death loss was 2.3% and 1.5% in those years, but none were attributed to scours. So those are some, often in research, we're dealing with smaller magnitude differences than that. That's quite a treatment effect. Pretty fun to see. Okay, so how big a problem is calf scours in the beef industry yet today? So this is NOMS data, and it shows that scours is still a major killer of young calves. It's behind only birth-related problems and weather problems as a known cause of death in calves less than 3 weeks old, and is behind only respiratory problems as a cause of death in calves from 3 weeks to weaning. So here is the digestive problem bar, and it's up there. It's still a major cause of death in calves. So NOMS, this is from the NOMS 2007-2008 data. NOMS is a USDA group that conducts comprehensive surveys of livestock industries, the beef industry included. Their last cow-calf study came out in 2017. And this is very easy to find. It's for your information. You can just do an internet search for NOMS beef. You can see that acronym up there at the top of the slide, NAHMS, and you'll see everything. It'll be right there. So that's, if you've never seen NOMS data before, it's well worth looking through. You'll find all kinds of fascinating things there. Okay, so how many operations are using Sandhills calving methods? So this is more NOMS data. So they broke beef operations into 3 different groups. They said small was going to be between 1 and 49 cows. Medium would be between 50 and 199 cows. And then large would be 200 or more. And of the groups that are 200 cows or more, the operations, 40% reported using Sandhills calving methods. So that's a pretty rapid and extensive adoption of Sandhills calving methods in those groups. So glad to see that. Okay, and then if you break the country into 3 regions, west, central, and east, 27% of operations in the central region reported using Sandhills calving methods. And I'll show you the regions here. So Nebraska's in that central region. So pretty good uptake of this type of methodology there. All right, so what about pen or lot-based calving systems? So can you do Sandhills calving in lots instead of in pastures? The short answer is I think so, and I believe it's well worth trying if you have to calve in lots. In personal communications with one of the researchers who developed Sandhills calving, he said he believes it will work well in lots, but the same level of data is not available yet. So there have been some similar results to the 2 study herds that I've showed you, obtained in pen-based calving trials with an 84 head group in Mitchell and Meade, and that data was presented at the Ing Cow-Calf Symposium in 2013. So it's looking good, but there isn't as much data on it yet. So if Sandhills calving won't work as described on your operation, some pointers that you can still gain from this presentation and some things that you can keep in mind are just to consider manure from 2 to 4 week old calves toxic to newborns, and just find ways to keep them apart. Shoot for keeping calves with other calves that are within 7 to 10 days of age of them, so in 7 to 10 day age calf cohorts. Make sure they have a clean, dry place to lay down, especially for their first month of life. And don't forget the knee drop test. Calves should have a place where they can get, where if you drop to one knee with insulated coveralls, you don't feel the wetness come through to your skin. So that's a really good rule of thumb, just a good husbandry practice to keep in mind. So some other things you can gain from this type of thinking and these concepts are calf playpens, the portable floorless calf shelters that can be really helpful if you end up in the middle of a ugly winter storm. They can be moved to clean ground when necessary. You could keep ground clean by fencing off an area before the beginning of calving season to prevent contamination of that ground. You could rebed it when needed to make sure to pass that knee drop test. One other note that's worth considering is that it's just interesting. Calves born on operations where there's no defined calving season often have little trouble with scours because they rarely are in a situation where there's the opportunity for those sequential infections to occur. Okay, so this Sandhills calving methodology is an example of how manipulating a system can change the outcome dramatically. And the discipline of working to understand and devise systems-based solutions is called systems thinking. There's a number of us here at UNL that have been working on trying to develop our skills in systems thinking, and so you'll probably hear more about that in years to come as we try to convey what we learn. So this is kind of a foundational example of the goals of systems thinking.